everyone. My name is Katie and this is Meg, and we represent JoyKC, and we are just so thankful for you. If you are watching this video, that means that you have said yes to this ministry and volunteering at one of our upcoming events, and we could not do what we do without you. So thank you so much for just stepping out, maybe out of your comfort zone, stepping out in faith, and just coming to build relationships and serve and love this population that's often just neglected and put to the side. And why we do JoyKC is because we believe, God's heart is one for all people, and that this community is just often overlooked, and they play a huge, valuable role in God's heart in his story. So that's kind of our heart behind JoyKC, and we want to just build relationships and empower and just bring light to this community that, that just doesn't get the just attention and value that they deserve. So we're going to go through a PowerPoint slide. You'll hear both Meg and I talking, and you'll see the PowerPoint slide on your screen. And just kind of we'll go over the rules and the guidelines of our events to give you a better picture for when you come.
Yeah, as Katie shared, people with disabilities can often represent a community that is overlooked, mistreated, and misunderstood. And a lot of that comes from society's filtered view of negative stereotype and outdated belief regarding people with disabilities. Some examples of that include that they are presumed to be helpless, unable to care for themselves, unable to make their own decisions. That could mean that they are denied jobs, housing, and other opportunities, seen as vulnerable, often targets for physical or sexual assault, social avoidance, and in some cultures, folks with disabilities are considered cursed, which is really why, as Katie shared earlier, that the heart of JoyKC is to help rewrite some of these negative stereotypes through the context of friendship.
So there is a ripple effect for when you guys come and say yes to this ministry. The more volunteers that we have, then the more guests and peers that we can serve, which then in turn blesses the parents, the families, the caregivers for a few hours, and in hopes that the kingdom that is expanding. At all of our events, we do a short message and some worship music, and our goal in all of this is not just to build relationships, but to really expand God's kingdom. So we just thank you for saying yes, for volunteering, because then we can start serving more guests. Okay, so your role as a volunteer, we have kind of like a buddy system where our peers, which is kind of the word that we use to say for our guests with disabilities that come, are paired with a volunteer for the night. So we do this because we believe this model not only promotes social engagement, but also allows for the peer to be given support when they need it. So if your peer needs assistance with grabbing their snack or help getting from one place to another, that this model really helps with that. But again, like our heart behind this model is to build those relationships. So in order to be a volunteer, specifically to be paired with a peer, you must be 15 years or older. Now, if you are a family with young children, we would still love to have you volunteer. We can pair your kids up with each adult. We've done that before, or your family can help pass out snack or run like a station. So in order to be paired with a peer, you must be 15 years or older. We do offer service hours for anyone, whether you're a student or an employee where your job requires service hours. You just let us know and we offer those. And then we do run background checks on all of our volunteers.
Yeah, we just want to kind of pause before we get further into our training and just recognize that it requires a lot of bravery to show up to something like this, especially if you don't have prior experience serving or loving this community. And so we just want to affirm that you are brave and that having past or prior experience with this community is obviously really awesome, but in no way is a prerequisite for being a volunteer with our ministry. If you are someone that is willing to show up and someone that's willing to say yes, then you're absolutely perfect in everything that we need as a volunteer. JoyKC really wants to offer a safe place to learn and to grow in confidence and relationship with community members with disabilities. And just as a disclaimer too, you're never gonna be put in a situation where you're alone that like goes totally against our own liability as well as the mission of JoyKC and our desire for relationship. So what is a disability? A disability is defined as a condition caused by an accident, trauma, genetics, or disease, which may limit a person's mobility, hearing, vision, speech, or mental function. As another disclaimer, disability is an incredibly individualized concept. So even if you know two people with the exact same diagnosis, their experiences of their disability are gonna be really different. According to the CDC, approximately 1 in 4 adults, which is about 61 million Americans, have a disability that impacts major life activities. People with disabilities represent one of the nation's largest minority groups, which uniquely anyone can join at any time. A lot of other minority groups, membership happens through birth or maybe the onset of aging, but this is a very unique minority group in that people might be born with it, or people might have an accident later in life. It might be an onset of aging, but anybody at any time could join this minority group.
Okay, so as Meg was saying, all disabilities are individualized, and I think that's just really good to not only come into our events with that mindset, but also just in daily life, being around people with disabilities. So it is common for some people to have multiple disabilities or health conditions. Many of our peers who come may have areas that they need help with, but instead of making assumptions based off of maybe someone else you know with the same diagnosis, we really want to take time and learn about this particular individual, what they are capable of doing, what they have learned how to do thus far. And so we just want to serve out a relationship instead of assumption with assuming, okay, well, I know this person with this diagnosis, so you must be like this person. Just like we're all different, and we're all, you know, different in our abilities and gifts and talents. So are they. So we just want to serve out of that instead of assuming. Okay, so we're gonna go through just a few diagnoses that are just more common maybe than others, especially at our events. Again, this is just gonna be a broad overview, and so not everyone fits into this, you know, box of this diagnosis, but just to give you some background, autism spectrum disorder is a developmental disability that significantly can challenge an individual in social areas, some behaviors, maybe some speech. Some individuals with autism may be nonverbal and can communicate through their actions, through sign, or through a communication device. Autism is very broad, and it also is very, it's getting more and more common. So 1 in 54 children in the US have the diagnosis of autism. According to the CDC, the learning, thinking, and problem-solving abilities of people with autism can range from gifted to severely challenged. Some people with autism need a lot of help in their daily lives, others need less. So again, that's just important to remember. If you are paired up with someone with this diagnosis, that it is a huge, broad range, and that we want to get to know the person before we make assumptions.
Down syndrome is also an example of a common disability that we might see at our events. Down syndrome is a developmental disability / genetic disorder in which a person is born with an extra chromosome. According to the CDC, approximately 1 in every 700 babies in the US is born with Down syndrome. About 6,000 babies with Down syndrome are born in the United States each year. Some common symptoms, and again, very individualized, may not totally apply, but in general, include mild to moderate IQ, the measure of intelligence, developmental delay, distinct facial features, and low muscle tone.
Another common disability is cerebral palsy, CP, and this mostly affects people's motor abilities, their muscles. So it can affect like their movement, their posture. Some people with CP are in wheelchairs because it affects more of their whole body. They might require special equipment to talk, to walk. And some people with CP may also have intellectual disabilities and seizures with some other conditions. But again, some people with CP do not have any sort of intellectual disability, and it solely affects their muscles.
The next one we're going to talk about is visual or hearing impairments. Vision impairment means that a person's eyesight cannot be corrected to a normal level. So meaning they can't go to the eye doctor and get a new prescription and see in a typical way. A hearing loss happens when any part of the ear or auditory system is not working in a usual way. The degree of hearing loss can range from mild to profound. Some individuals may require alternative forms of communication, like American Sign Language or assistive technology, PEC systems. Some individuals may also utilize guide dogs. So really at JoyKC, we want to serve in excellence. And that looks like a lot of different things. But for us, these are two different examples of ways that we would like to empower and encourage our volunteers to serve in excellence. And the first one is communication etiquette. So speaking directly to the person, using age-appropriate voice, age-appropriate conversations, even if you know exactly what someone is trying to say, really waiting and being patient and letting someone finish talking to finish their sentence. Again, all of this comes back to dignity. We really want this experience at JoyKC to be incredibly dignifying, and the way that we speak to someone and the way we interact verbally is a really big way that we can speak value over people. The next area is self-determination. And really, frankly, that just means if someone can do it, then they should do it. We can offer assistance in a dignified way. That doesn't mean we can't ask for help, but we're not assuming that someone needs help. We really want to promote a safe environment that encourages appropriate behavior.
So as Meg was saying, in terms of communicating with dignity, one way to do that is by describing the person before ever talking about their diagnosis. And first, I just want to say the most dignifying way to acknowledge someone is by using their name. So we really want to make sure we learn our buddy's name, who we get paired up with for the night, and we call them by their name, obviously. It is disrespectful to put someone's diagnosis before who they are. And hopefully there would never really necessarily be a situation where you need to call someone out with their disability. Just like if Meg wore glasses, I wouldn't say, hey, this glasses girl is sitting next to me. Hey, that's just disrespectful. So if we need to include their diagnosis in maybe some sort of conversation, we would say, you know, their name or the girl with Down syndrome, rather than ever saying like the Down syndrome girl, because that also just sounds really bizarre.
Sounds weird.
So that's just a little rule of thumb as well. Okay, as Meg also said earlier, that you will never be put in a situation where you are alone with a guest. We always have a rule of three. So if your guest needs to go to the restroom, you either come get Meg or myself or just another volunteer and be like, hey, can you walk with us down to the bathroom? Because there should never be any situation where you're alone, even if it's just like a hallway that leads to the bathroom. All of our events are done in groups. So we're always all together in large rooms. So again, this would be very hard to ever be away from the group. But if in a situation where your guest is, you know, going a different direction, then it would be necessary for you to call another volunteer to be like, hey, can you come with us while we walk down over here? Confidentiality is another huge safety issue. You're going to be given what we call a yellow card, but it's a card with your guests' medical and personal information. So it'll have their age on there, their diagnosis, any sort of food allergies. You should read this. I will be there giving you this information. And once you're done reading it, you need to give it back to Meg or myself. Again, because this information should be kept private, it's for you to know how to best love and serve your guest. And then you're going to give it back to us so that we can keep that private. Okay. Another area of ministry safety is just acting in a certain way, or acting respectfully and in control if there are any sort of problem behaviors. Again, we really don't see this at our events, but just we want to err on the side of caution and go over this. So a problem behavior, for example, might be displays of aggression if someone's getting really upset, or touching other people inappropriately, or whatever. So when that happens, if in a more severe case, Meg or I will have everyone kind of evacuate the area, and we will handle that situation. But we just really want to remember that no matter what is happening, we never want to put our hands on people in any way. So again, if there is a more severe case, Meg and I will get involved, and you will not need to handle that, but we just don't put our hands on other people. If we need to help guide someone in the direction that we are wanting to go, we're going to use an open hand. And if I want Meg to go this way, I'm not going to be like, Meg, and push her. I'm just going to guide her with my hands open, leading her in the direction that we want her to go. Go ahead.
Bathroom support is the next area that we're going to talk about in terms of ministry safety. We always, as Katie said, rule of 3 is really important in this area. So if someone needs to go to the bathroom, we always take a third person to the bathroom, even if the person is completely independent and doesn't need any help whatsoever in the restroom. You and another volunteer or another staff member need to stand outside of the stall so that you're in the general area. In the case that someone needs bathroom assistance, we always want to keep this dignifying, wiping front to back, always wiping even if it's number 1. We're never flushing wipes down the toilet. And again, if a guest does not need assistance, we do not leave them unattended. At the front of the room at JoyKC, we always have a tote with a lot of different bathroom supplies. So in a more urgent situation, you are always welcome to get gloves, and we have diapers and pads, and we have all of that on site and on hand. If this is an area that you feel uncomfortable in, please recruit me or Katie, and we would love to assist you in this area. We do not want this to be something that prevents you from not coming to an event. But nature is a reality of the human experience, and so that's why we're talking about it. The last area is just wheelchair etiquette. Again, a wheelchair is an extension of someone's body, and so we really want to honor it and to treat it nicely. So if you are directing someone in a wheelchair when going through a doorway or an incline, always make sure you go backwards. This will prevent the person from falling out of their wheelchair. And then always wanting to ensure that the buckle is fastened before any transport happens.
Okay, and things we want to limit at our events are gum, and mainly because of the wheelchair etiquette, that if for some reason someone's chewing gum and it gets dropped on the floor, we would not want that ending up on someone's wheelchair. So please don't come with gum. And then another one is cell phones. Obviously, if you have a cell phone, you can keep that on you, but what we're trying to say is we don't want our volunteers to be just really engaged with their phones. At our events, we really need all hands on deck, all eyes on deck, and we don't want our attention going to our phones rather than to the people that we are serving. And then taking pictures of you and your guest without permission. So please ask your guest, hey, can I take a picture with you before doing so? Or coming to ask Meg or myself, being like, hey, could I take this picture? Like, is it okay with you if I post it on my Instagram? A lot of times it'll be fine, but there are a few instances or some few individuals who would rather not be photographed. Okay, so some logistics. Our events are held on the first and third Monday of every month. Typically, there are a few months with holidays where we might just meet once a month, but always check our website, and it has our whole calendar out there. We do meet at Community Covenant Church in Lenexa, And our events start at 6:30, but we do ask volunteers if you guys can get there close to 6. That's really helpful. Again, if you cannot get there right at 6, please don't let that prevent you from coming. We can always use your help. Just let me know, and we can arrange it with your schedule. So again, we just want to say thank you so much for saying yes. You really are bringing heaven closer by coming and loving and serving this population. And again, my email is katie@joykc.org for any volunteering questions. If you have friends, please share our website with them, joykc.org, and or friends or family with disabilities. Meg can get them hooked up to with registering to come to our events. So thank you guys, and we look forward to seeing you in person at our events.
Thank you guys.